Hi, this is Dr. Nick. I'm the incrementalist here with incremental steps for a better business and health.
And I'm Fred Goldstein with Accountable Health, and I'm here working on healthcare system redesign and helping employers as they work through some of the latest issues with COVID-19. So, Nick, let's begin this week. Again, more changes in healthcare. What's been going on? What areas are you looking into?
Well, there's always changes in healthcare, that's for sure. And it's always rapidly changing underneath us. So it's very difficult to keep up. I think the predominant message today is what are we going to have to do to open up our society again worldwide, but specifically in the US from our perspective. And that really boils down to something that I've heard repeatedly, which is the three T's. That boils down to testing, tracing, and then treatment. Testing, I think people are familiar with. It's clearly a sort of foundation. We've got to be able to test both if you have the disease and also have had it and are resistant to it. But let's talk about tracing. That's one of the things that's raising a lot of ire and concern. And one of the things that we know is that we can trace without killing people's privacy and the security of their own information. That's one of the things that certainly this country, the United States specifically, is very protective of, rightly so, is individual rights and the ability to protect you. And that is possible to do. We can do it without uploading our data into the cloud, making sure that everything is encrypted. We can do this Bluetooth, low energy Bluetooth contact tracing, and alert people anonymously so that there's no sort of loss of privacy of information of people that have COVID. So this is something that's possible. I saw an interesting paper that was based on something called whisper tracing that essentially offered a pathway. So the one thing I would advocate is that we should do this, but without giving up our privacy and our freedom. Let's not go down the same route that we saw with 9/11, where everybody says, give it all up, who cares, allow them to track and trace everything, because we know that that's going to be abused. And then the final thing I'd add from a healthcare standpoint that I thought was really interesting and separated out cities, a paper that talked about the spread in New York, which has been especially bad. I think fully 1/3 of the deaths in the United States are in the New York area, seems to be attributable to the subway or the metro system. That's an interesting finding, and it makes for some questions as to how we reopen up these things, because they're an essential part of our world.
Yeah, that's really interesting, Nick. And would that possibly explain maybe some of the differences between, say, a Seattle that doesn't quite have as much mass transit and a lot more people in cars versus New York?
Yeah, it also makes for a, gosh, everybody should get into their own car. And actually, the thing that really stood out to me, and this was at least 2 or 3 weeks ago, was the loop, as it was called, which was essentially a high-speed network that was being proposed. It's been less than successful in terms of its sort of penetration, but the idea was to create pods that people got into, and that would be a better version. And it was based on a faster transmission or transfer from distances using vacuum seals and so forth. So I think maybe what we have to wait for is obviously looking at other cities like London, where they have a huge metro, and to see if there's been an impact there. But certainly, more data, and it's going to inform the way that we start to think about opening up. Which brings me to the question around opening up, which seems to be happening in your area, Fred. What's going on in Jacksonville?
Yeah, we kind of hit the national news this past weekend. Maybe not in such a good sense. The governor of the state announced that you could reopen beaches and that each local government had the approval to decide whether or not to reopen them, and Jacksonville did. Apparently on Friday at 5 p.m. Now it's open from early morning until like 11, and it closes midday, and then it opens again. And they have certain rules around restrictions as to, no sitting, don't bring a towel, don't bring a cooler, don't bring a grill, and are trying to keep people active. But apparently there were a huge number of folks on the beach, which created an unbelievable Twitter hashtag Florida Morons, which has been trending quite seriously for those on Twitter who want to check it out. So that's been interesting to watch. I chose not to hit the beach. I think maybe that's probably the wiser idea at this point. And don't think that that was quite the right idea. It might be a little bit early here in Florida, and particularly in Jacksonville. While our hospitals haven't been inundated, it clearly is something that has some potential to cause some serious problems. So we'll see where that goes. The other area I've sort of been looking at, and as you mentioned earlier, is hey, people are beginning to say, how do we return to work? What do we do? How do we figure that out? And that's something that you and I have been thinking about and are looking forward to launching some educational programs, as well as potentially some consulting services to companies or employers that are looking to reopen. And I think there's some serious things that they need to begin to consider that we can help them put together, including developing a plan, looking at your own workspace. Is it an area that is going to bring a lot of people back initially? Think about people in the haircutting industry. I could certainly use one now, and I think that pent-up demand for certain services is going to be very high, while other areas might not, and help people understand what are generally the risks associated with this.
So as you think about that, what are some of the elements that people are going to have to consider, and what is it that we're planning on bringing to the table to help smaller companies be able to open up? You talk about hair cutting, that's a simple but important example. What are we thinking about?
So I think what we'll help people do is, one, help them figure out what they need to do to build a plan, which includes looking at your workspace, your business. What is the risk associated with your business of your employees coming back? Do they work close together? Do they work far apart? What are some ideas around how you can create that potential distancing? You mentioned contact tracing. Is there a need to begin to understand that and deeply understand, as that gets rolled out, what that might mean for your workforce as people begin to trace through and you identify individuals, or the government does, that have contacts with somebody who had COVID-19? And then looking at other things, for example, cleaning your workspace. What happens if somebody comes into your workspace and was infected and you're notified a couple days later? What do you need to do then? What are some of the policies you'd probably set in place? What about visitors? How can you effectively handle visitors? And I think we'll also get into, as we've discussed, how you can use systems like this to continue to work effectively and efficiently as an employer for those that can do sort of remote meetings or things like that. So we'll cover a lot of different topics across the space, including understanding the virus to begin with and how it spreads, and then get into some more details for employers themselves.
So I think the overriding message is, this is a really complex area. You need expert help. You may not be able to afford full-time folks, but having individuals that can both help you and provide training are really an essential component and a contribution to getting the company and society and the economy opened up again.
Absolutely, Nick. I think that's right on target. And with that, we'd like to thank you all for joining us this week. I'm Fred Goldstein with Accountable Health.
And I'm Dr. Nick with Incremental Healthcare, with incremental insights for health and business.